Thank you very much, Presiding Officer. It's almost 500 days since this Cabinet Secretary took office. His performance in that time has unfortunately been woeful, and the consequences have been devastating for our NHS, for the hard-working staff and for patients. Our NHS is literally on life support, and I fear that the SNP government is shamefully complacent and not up to the task of fixing this. Of course, COVID exposed the weaknesses in the NHS, but we know that the problems predate the pandemic. There were already 420,000 people on waiting lists before the pandemic. That number now sits at 750,000. That's 1 in 7 Scots. So what has the Cabinet Secretary been doing? Well, I will hand it to him. He's been a record breaker. A&E waiting times were at a record high last week. Delayed discharge also at a record high. Elective surgery at a record high. The list goes on and on, but the consequences are devastating. 7,174 excess deaths, most of them not due to COVID. And using the same estimates as the Royal College of Emergency Medicine, potentially 1,400 people lost their lives or had much worse outcomes because of delays at A&E. Under his watch, I'm struggling to find anything substantial that has got better. Now, I accept that all this takes time, and it's not, to quote him, a matter of weeks or indeed months. But the Cabinet Secretary has had almost 500 days in which to make a difference. In May 2021, when he took over, remember, pandemic restrictions were still commonplace. A&E waiting times had 86% of people treated within 4 hours. Now, it's 63%. The number of people waiting over 12 hours has risen by a stunning 1,012%. Not 112%, 1,012% under his watch. No, I don't. I'd rather you listen to this. Waiting times for elective surgery were over 94,000. Now they are almost 140,000, a 27% increase. Bed days lost to delayed discharge was over 35,300. Now it's almost 56,000, a staggering 58% increase. A shocking 685,000 bed days have been lost since this Cabinet Secretary came to office. And all of these measures are not getting better, they're getting worse. New figures published just this week show that performance against the 62-day cancer waiting times target has plummeted to the lowest point since records began. More people will die of cancer because of this. This is dangerous incompetence on the part of the SNP government. This is years of poor workforce planning, cutting training places for nurses, years of cutting hospital beds, years of underfunding the NHS and social care that are all coming home to roost, years that the SNP have been in charge. And there have been an array of people trying to offer them advice. The RCN, the BMA, the Royal College of Emergency Medicine, the Royal College of General Practitioners, the Royal College of Physicians and Surgeons, all experts in this field, but the Cabinet Secretary is not listening. Instead, he is presiding over an exhausted and demoralised workforce. Our NHS staff really are going the extra mile to care for us. They deserve our undying gratitude, but they need more than warm words from the Cabinet Secretary. They need a recruitment policy worth its name, action to retain staff who are leaving the service early because they have had enough, and decent pay for the whole workforce. Staff are the beating heart of our NHS. We need to support them if we are to recover, and with a winter crisis looming, there is no time to waste. Presiding Officer, when a health board is failing, they're put in special measures. The NHS can't wait any longer. They need urgent help, and if the Cabinet Secretary is incapable of delivering, then it's high time that he is put in special measures. I move the amendment in my name.